Hello and good evening. I'm Desiree Miller with the Pennsylvania Birthkeeper and Herbal Doula Training. I am coming today to talk about midwifery care and how that can differ depending on what kind of midwife you choose to hire. So there's different kinds of midwives. There are nurse midwives, there's CNMs, there are CPMs, certified professional midwives, and then there's lay midwives, traditional midwives. Licensed midwives are going to be the CNMs, the nurse midwives. They are held to certain standards and they vary across the board in various states and different countries. So these midwives are required to follow the laws per their state. So some of them will be required to risk women out of care at 42 weeks. Some will be required to risk women out that have a breech presenting baby. Some will be required to transfer women who are shown to be carrying twins. Different things like that. Variations of normal that really should be able to be handled in home, but they, by the state, are required to fail these women, essentially. Because women don't know. They don't know if they're going to go past 42 weeks or if their iron's going to be a certain number or what kind of complications are going to come. And these people are required to bail out on these women. A lot of them not getting any kind of reimbursement or just being transferred out of care and feeling abandoned with no one there to support them. The same thing with CPMs. I don't believe that they are held to as high of regulation, but again, it varies by state. The state that I am in Pennsylvania, we do not have licensure. We're one of the few. We do have CPMs here. That is a national organization, so anybody can be certified in that regard. I personally choose not to for various reasons. I don't want to follow anyone else's rules aside from the woman and the woman that I'm serving. So it's important to know when you're hiring a midwife what kind they are, what reasons they're going to risk you out for. Some women find that they are trusting this woman, they agree with their plan, especially VBACs. They're planning this beautiful birth, and this lady is so supportive the whole time. And at the end of the pregnancy, they pull this bait and switch, is what it's called, where they will say, oh, okay, yeah, everything's great. And then near the end, they start finding problems that aren't really problems. They just make these things up and take like different labs and try and make it look like this woman's unwell, scare her into maybe another cesarean or to go to a hospital to try for a VBAC, which we all know is quite silly because although they do happen, they happen. It is less likely in a facility than at home, especially for those who have longer labors. So it's important to know of all the reasons why a midwife would transfer a woman out of care, and when interviewing them, ask them these questions. Ask them, what are the reasons that you would possibly drop me from your care or transfer me to obstetrics? What are the different reasons that would disqualify me from having you at my home birth? In that scenario, will there be a refund? Will there be any kind of reimbursement? Or am I just left on my own having to go to the facility? These are really important things to keep in mind, especially for first-time moms. The biggest one that I see is women who go over 42 weeks. We should always keep in mind that a due date is nothing but a guess, and it's based off of possibly a missed period, possibly an ultrasound. Both of those are not accurate. For the most part, they're not. So it is not, in my mind, very important to gauge a due date and base everything off of that. I think that is very harmful. And as a mindset, because the woman could actually only be 39 weeks and just had a very misread ultrasound that relayed off dates. So know about these things in advance. Know the different reasons that they could transfer you and know what you'll do in that scenario if you do hire a regulated or licensed midwife. Also, keep in mind that there are also people who can attend that will practice traditionally, such as myself. Doulas will also attend free birth. Many of them will. If that's something that you'd feel comfortable with, not everybody is, but there are always options. Never settle for a provider. If you are ever stuck and you're like, wow, this person abandoned me, reach out. We can find someone to help you. We can find someone in your area that can help with whatever's going on. So it's always important to keep in mind with midwives that there are reasons and different scenarios where they may have to bail on you. And it's important to know about those in advance and know what kind of attendant you have at your birth prior to birthing day.